Dr. Arp. I'm a podiatric surgeon. We're going to perform a permanent matrixectomy today. What that is a permanent removal of a chronically ingrown toenail. So we have a patient here today with a history of recurring ingrowing nails that we cut out sporadically throughout the year, and she's ready to have a permanent done. If we don't cut them out, they get infected. So she's ready to have a permanent solution to her chronic problem. So what we're going to do today is numb up her toes. We're going to do an edge on this side and this side. Okay, and you can see her nail digs way in there. And it's been cut out, otherwise it would have infection in it. And this one gets ingrown on the sides when you push up on it. So it's been cut back, but she's tired of that and she wants a permanent solution. So we're going to numb her up today. I'm going to freeze her up when she, so I freeze it up. Do a little stick here, right on top. That helps to make it not hurt. It kind of hurts down on the bottom there. That hurts. She knows it, but she's tough. Do one on this side. Freeze it. Come down right about there, and that burns us for a second, and then we're done with that one. Lucky her, she's got another one, but she's a pro at it now. So there's a nerve on each side, one there, one there, one there, and one there. 4 in a toe on each quadrant. We'll freeze it so the skin is numbed up. We'll pop through, and then we'll head down to get that other nerve there. See, of course I've got this camera in my face. No excuses, right? And then we'll numb this side up. You okay, Em? Mm-hmm. Thank you, that's awesome. That one burns. She did good. So now, we'll let that set up in about 5 minutes. And we'll scrub her toe up here. Just do a little betadine scrub to clean it up. It's fairly clean already. A nail is a clean procedure. Usually can't get a toenail sterile. So we just need to keep it clean. Okay. We put a tourniquet on it. We use our special blade to cut the edge out. You pick just so much. We go down to the root. Okay. Then we go on this side where it's a little deeper. We need to make sure we got that edge just right. We use a flat edge instrument called a Freer instrument. We slide that down. And we slide this one down. There they are. We take this instrument called a needle driver. And we do the same thing. We get that root out of there like that. That's the nail root. Now there's still cells that will produce a nail if we don't cauterize it. Okay. That corner out. We take our curette. Of course, we have all that. See, all that over the years has built that up, that keratosis. And we want to make sure we don't leave any nail root in there, because then you'll get a regrowth if you don't. Of course, I cut this off here. We're looking good here. Good clean. Didn't leave anything in there. Now we want to exsanguinate the toe, making sure that it's dry when we put our chemical on there. So I'll exsanguinate. Most of the bleeding has already occurred. When we have our tourniquet, it doesn't allow more blood to come in, see? So I create a dry field for my chemical to work. So you got to make sure you exsanguinate everything out of the toe. So that toe is devoid of blood. There we go. We're clean. So that's when we'll go with our chemical. Slide that down. We want to kind of clean up the rest of it so it doesn't go all over the skin. That's good. And it doesn't, the root inside here is protected by the nail. That's why it won't take over the whole nail. That's why you make sure you don't lift up and allow that medicine and that agent to seep underneath and create more nail destruction than you want. So you're calculative and you've got it right where you want it. Go through our cauterization here. Looks like a saber-toothed tiger toe. Maybe not. Rabbit ears. Chopsticks. Keep your mind active. These are the jokes. Okay, and then we'll just occasionally take a look. You can see how it's cauterized. The tissue's become a little blackened, and that's what we want. That looks real good. That looks real good. So now we want to neutralize that with our acetic acid. Make sure there's no tissue in there. Now these little holes will fill in. They'll heal in, but it'll take about 4 to 6 weeks for these to fill in. It's going to drain the first couple weeks because it's a burn, and it will drain here. We'll soak it, and then it will heal in just like that, and it will be perfect. It'll look great. Of course, that will grow out, that little piece there. A little darkened area is going to grow out, but that will prevent regrowth. Then we take our Sylvanine. We wrap this and we leave this on until tomorrow, where she'll start soaking it in a diluted vinegar solution for a couple weeks, and then warm soapy water after that. Never leave your tourniquet on. She won't have to worry about an ingrown toenail if you leave that on. Anyway. I know. So that is a permanent matrixectomy for chronically ingrown toenails.